either diabetes, blood pressure, or blood pressure, diabetes, or increasing creatinine level, and all affecting the kidney and other functions and all together. Means you have to find out, study in all the aspect of the patient. Those who are not doctor, they are psychologists, they must take the physician report or advice to investigate first. Everything is normal, then we will have the counseling and we will do that way. Or otherwise you continue your medicinal line of treatment as it is. We do counseling, that see how it is more effective to you. There is the way you have to find out your own level of or own degree of practice. We can't say you only you go psychologically or only counseling, only medicinal line of treatment is not effective. That's why the failure rate is much more what we are seeing in our society. Because once you know the clitoral stimulation, and most of the time if we go ahead, sexual dysfunction part of the metabolic syndrome where you just continuous distributing organic, psychogenic origin. When the patient comes to history with sudden history of 1 week, 2 weeks of erectile dysfunction, always think about the psychogenic origin. Suppose stamp test, it's just corrugated paper stamp you apply at the base of the, prepare the ring and give the patient and apply here, and see it's in the morning it's broken down, because always in rapid eye movement in the night duration they have the blood flow is there. Blood flow is there means it's broken down, means there is no organic cause. It is a psychogenic origin. You have to do. Otherwise you have to go for resistant test, those who can go for the Doppler test and other things, whatever depend upon your patient requirement and patient's psychology. Or no doubt, it is my institute working for academic. I am academic. I don't know what, but I am also taking care of how you can do the best in your practice. Okay, fine. This organic from psychogenic, you know very well. There is a one penile tumescence and rigidity monitoring is a Regiscan test. You have to apply the Regiscan, apply the electrode to the penile shaft, and keep the record whole night after admitting the patient, and keeping the record in morning. You see the blood flow, how is the blood flow and other things. Accordingly you can treat them. I am not taking your much time because it's a work of urologist and other team of radiologists, other works, they do it. They also find out pre-test and after injection of what we call papaverine, bimix and trimix injection mostly, but that should be given under institute level. Don't do yourself, because priapism is most common. I suffered, I've seen, because 40 years back when the patient comes, sir, I want to do this, I'm married, I ask him, I made it a very titration of dose at my clinic, and after this half hour erection is okay, then the dose is sufficient, then it becomes placid, it's okay. So he has taken 2 injections, both the sides, and he get the erection more than 3 hours, 5 hours, or he never turn off. He feel that he is okay, but it's by mistake, accidental. Even if we explain the patient make the mistakes and causing then need what we call urological role, and implant is the only solution. But implant is not the solution, because other things you have to maintain, because at a young age he has to go for fertility issue comes, other things comes. So be careful. So don't do the injection therapy on your OPD basis. That is my request to everyone. Though it is a therapy, you can do it, but be careful. Then you should have the observation, one day stay, you come back again, instruction like that after 3 hours, 4 hours after your this whatever way you want, you come back to us. Regiscan test is over. Now my dear friends, medical management of ED. First, oral, whenever a patient comes, take the history and everything, have the counseling, but a patient is not interested to accept the counseling, the oral therapy you can start. That you have to learn. Means everyone must have the physician. Suppose patient is taking oral, then counseling part, rule out any myth and misconception and correct accordingly. And lifestyle measures. Lifestyle measures, those are diabetes, reverse them. If asthma, reverse them. Hypertension, reverse them. Remission programs. And this is the way what? Second line of treatment is intracavernosus injection. If everything is not working, but be careful, intracavernosus injections, what I told you, should be titration of the dose is very important, and accordingly, and sometimes it's very costly when you add prostaglandin. Prostaglandin cost itself is 5,000 above, and peppermint costing less, 10 to 15 rupees or something, what I don't know at present, but these are way, but be careful, there are better options with us, is after vacuum erection therapy is shockwave therapy. Shockwave therapy, patient get the result, but not in one sitting, you can repeat. Even in US, Canada, shockwave therapy is done not by doctors, by the therapist. They are qualified and they do it. When anyone here can be do shockwave therapy, because there is no medicine. If you know how to do it and all, you can do it very well. Shockwave therapy is over. If not, then you can use PRP, platelet-rich plasma, growth factors are injected. We are going to learn tomorrow. Those are interested to see the things. Surgery line of treatment, what you are discussing with all things. If needed, necessary, you do it. Otherwise, younger age group, no use to go for surgery. Lifestyle measures is very important. That's why we are focusing more what lifestyle measures you should do it.